Welcome, and thank you for checking out my video series on running grief support groups. This is the first video in a series that will cover topics and issues related to starting, running, and ending grief support groups in a variety of settings. The overall theme of this video is focus, the focus of this video series, as well as your own focus in starting and running grief support groups. Most people starting groups for the first time don't know where to begin, and one way to address that problem is by identifying your purpose and the purpose of the group setting. First, I'll address who this video series is for and what it aims to accomplish. Then I'll describe the different types of groups that are offered within the mental health and medical field so that you can better identify your role and the role of participants. Finally, I'll share the list of therapeutic elements that exist in most groups. Knowing these elements and identifying which elements are most important to your group can aid in helping you to understand your aim with the group and what to attend to within and across group meetings. This video series is primarily targeted towards non-licensed grief professionals, such as grief coaches and hospice volunteers. This video series is also appropriate for licensed professionals who may have had little to no education on running groups in their graduate studies. Regardless of educational background, most people feel ill-equipped to manage the complexity of group dynamics, and this video series will provide a foundation for beginning to run your own grief support group. As a disclaimer, these videos do not replace formal education in group dynamics. Opportunities for in-depth learning will be discussed in a future video. There are generally three types of groups: process groups, psychoeducation groups, and support groups. Process groups are generally considered the standard type of group, though also the most unusual to lay people. In a process group, the focus is primarily on the interplay between participants, with the facilitator helping participants to understand themselves through interacting with others. These groups are highly focused on what is happening within and between participants throughout the session, with less focus on external or past events. These groups are designed to go on for several months or years. Psychoeducation groups function more like classes, where the focus is on gaining information and having a space to practice skills that are enacted outside of the group. These groups are almost exclusively time-limited and are less focused on participant interaction. Finally, support groups are focused on providing space for emotional processing, with participants receiving emotional support and encouragement from the facilitator and from each other. I find it helpful to think about these groups not as distinct categories, but as existing in an overlapping way. Most groups of one type include elements of other types, and part of defining the scope of a group involves deciding how much influence each type of group will have on your unique group. This will be determined by factors such as your professional scope of practice, your interest and expertise, the demands and constraints of your work setting, and the needs of the participants. When determining the role of each group type in designing your group, I found it important to consider the defined roles of the participants and the facilitator. In a process group, the participant is encouraged to share and discuss whatever comes to mind throughout the group, whether that's an internal experience or an interpersonal one. The facilitator guides the conversation, with an emphasis on encouraging participants to increase awareness of interpersonal dynamics, to take risks in their interactions with others, and to take new perspectives or interact with others in ways that are therapeutic to all participants. In a psychoeducation group, the roles are primarily those of a teacher and student. The facilitator is there to provide information and guide participants in acquiring skills, while the participant is learning to express themselves and develop skills that help them to better navigate the challenges that the group is focused on. In a support group, the expectation of change is less emphasized than in process or psychoeducation groups, though participants certainly change as a result of engaging with the group. The facilitator is primarily functioning as a quasi-participant in the group, offering emotional support and encouragement along with other participants, while also taking responsibility for ensuring that the group remains a safe place to share emotions and experiences. When it comes to grief support groups specifically, there are many different configurations that can incorporate elements of process, psychoeducational, and support groups. Some groups will be primarily supportive, where the facilitator functions as a moderator while participants provide emotional support. I see the purely support-focused groups a lot in online drop-in groups, where psychoeducation and advice giving are actively discouraged. Other groups are primarily psychoeducational, where sharing emotional content or personal history is not the primary focus of the group unless the designated activity calls for it. This kind of group is often offered in settings where resources are limited, such as colleges or hospitals. Most groups, however, primarily combine support and psychoeducation, and this will generally be the assumption of this video series. My own experience and scope for my groups encompasses all three types of groups, where support and education are provided, and as the group matures, I acknowledge and encourage discussion about the interpersonal processes that are the primary focus of process groups. Another aspect of defining the scope of the group is identifying the presence of various therapeutic factors. This video series primarily draws from the work of Irvin Yalom, a leading expert on therapy groups. While there are many different philosophies about group dynamics, Yalom's philosophy is the most widely known and taught throughout the world. Awareness of the therapeutic factors helps us to know what makes a group effective. They can help us to identify what people are looking for in a group and what is contributing to each participant's growth as the group progresses. This video will just provide a brief description of each factor, and a future video will explore these factors in more detail. Yalom identified 11 different factors, which I've personally grouped into 3 different categories. The first category is emotional and psychological support. Within this category encompasses universality, catharsis, and installation of hope. With universality, the goal is to help group members realize that they are not alone in their suffering and the problems they face, and that others are willing to support them, which can help to move group members out of isolation, common with the grieving process, and it can be profoundly healing. Catharsis is about releasing strong or long-suppressed emotions associated with past psychological woundings, such as the loss of a loved one, and brings a sense of relief and allowing for significant shifts in one's internal experience. Installation of hope is about creating a feeling of optimism about one's future and the ability to cure that which doesn't need to be endured and endure that which cannot be cured. Within interpersonal and social dynamics, I've included altruism, group cohesiveness, interpersonal learning, and development of socializing techniques. Within most grief support groups, this particular category will be less emphasized, but can still be an important thing to acknowledge, especially for long-term groups. Altruism involves allowing group members to experience a sense of significance by helping other group members. As one comes to recognize that they have something of value to provide their fellow group members, they gain self-worth and confidence in their own ability to handle their suffering. Group cohesiveness is about giving members a sense of belonging, acceptance, and value, providing both a nurturing and empowering experience. This promotes security within oneself and in relationship to others, and is an important catalyst for group members to take the risks of self disclosure and change in and outside the group. Interpersonal learning is about providing opportunity for group members to learn about relationships and intimacy, in effect, helping them to develop supportive, authentic interpersonal relationships. Within the safety of the group space, members can openly share and communicate. In return, they receive support and respectful feedback, perhaps for the first time ever. Development of socializing techniques involves encouraging and advancing relating and social skills such as tolerance, boundaries, empathy, and conflict resolution. This helps reduce isolation and promotes connection with others in more meaningful ways, which becomes generalized over time into one's life outside of the group. Finally, we have the cognitive and behavioral insight category of therapeutic factors. Imparting of information involves educating and empowering group members with the knowledge pertaining to their specific situation, whether it be information about a resource or someone's personal story of how they dealt with the difficulties and experienced success. Existential factors are a much more vague category, but they involve one's individual quest to find meaning in their life. With the group, this involves the process of understanding and accepting the reality of the human condition, with all its frustrations and limitations. This is especially relevant and important with grief support groups, where grappling with one's mortality and the mortality of their loved ones is a central concern. With each other's support, group members learn to accept life on life's terms without seeking escape or denial, without fighting it, and without being paralyzed by it. Instead, they learn how to live with them and through them, seeing that obstacles are not in the way of the path, but in fact are the path. Imitative behavior is about helping group members learn more effective ways of confronting problems and managing relationships by witnessing how other members and the facilitator apply new and appropriate methods that disrupt old dysfunctional patterns. Finally, and probably less relevant to grief support groups than other types of groups, is what is known as the corrective recapitulation of the primary family group. We all come into the group having experiences with the very first group we ever encounter, which is the family group. What can be helpful about many grief support groups and other types of therapy groups is the opportunity to reenact and change some of the dynamics that were developed through family and childhood events using the safety of the group. This can act as a substitute for the family for each individual participant. New ways of relating can be formed, helping to weaken unhelpful patterns learned in one's family of origin. In summary, knowing the 3 different types of groups can help you to know your role and the role of each participant. This can guide your decision making in forming and running a group. In addition, knowing the therapeutic factors before and throughout running a group helps us to recognize what is at play as the grief support group unfolds. Some are going to be more relevant than others depending on the purpose of the group and your professional role. In a future video, we'll talk about these therapeutic factors and which ones may be more relevant to the majority of grief support groups and which ones may be more applicable to a more specific or narrow type of grief support group. Thank you so much for watching. I'll be posting future videos regularly, and I look forward to any sorts of questions or discussion that these videos may generate. Thank you.